5 early signs of chronic kidney disease you absolutely must not ignore. Imagine waking up one day, thinking everything's perfectly fine, only to discover your kidneys have been slowly shutting down for years, quietly, without giving you any clear warning signs. It's unsettling, right? What's even more concerning is that this scenario isn't just hypothetical. This silent damage is exactly what's happening to over 37 million people in the US alone, and the scariest part is, most of them don't even know it. Chronic kidney disease, CKD, is notoriously known as the silent killer because, in its early stages, it often doesn't present obvious symptoms. That's why it flies under the radar for so many people. By the time someone realizes something's wrong, the damage may have already progressed too far, leading to significant health complications or even life-threatening situations like kidney failure. But there's a silver lining. The good news is that kidney disease doesn't have to sneak up on you. If you know what to look for, you can catch the warning signs early and take action before serious damage occurs. In this video, we're diving deep into 5 early signs that your kidneys might be in trouble. These are signs that are easy to overlook but can make all the difference between catching kidney disease in its earliest, most treatable stage, and facing severe consequences later on. Trust me, you don't want to miss a single one of these signs. In fact, the last sign we'll discuss is something almost everyone ignores, and recognizing it could be the key to preventing further complications. Stick around, because this information could change, or even save, your life. The 5 early signs. Sign 5, foamy urine. Wait, foam? This first sign might sound a little strange, but it's something you've probably noticed at least once and dismissed without giving it much thought. But here's the thing, you should pay attention. Have you ever looked down into the toilet and seen foam or froth floating on top of your urine? At first glance, you might assume it's just because of a forceful flush or some random quirk in your body's process. But if that foam doesn't disappear immediately and lingers like the froth on a freshly brewed cup of coffee, it might be a red flag that something is wrong. This foaminess can be caused by a condition called proteinuria, a fancy term for when there's an excessive amount of protein leaking into your urine due to kidney damage. Your kidneys act like a fine coffee filter, letting the waste out while keeping the good stuff, like protein, in your bloodstream. But when your kidneys are damaged, that filter becomes faulty. It lets protein slip through, and that's what creates the foam. Normally, your urine should be clear or slightly yellow, with minimal bubbles that disappear quickly. But with kidney issues, that foam can stick around and even look unusually thick. Now, here's the tricky part. Not everyone who experiences foamy urine has kidney disease. It can be caused by other things, like dehydration or excessive protein intake. But can you really afford to take that risk? If you notice this happening regularly, don't just ignore it. Think of it like a fire alarm going off in your house. You wouldn't just brush that off, right? Similarly, your body is trying to warn you that something may be wrong, and you need to act on it. Studies have shown that persistent proteinuria is an early marker of chronic kidney disease and can indicate that the kidney's filtering system is already impaired. Even if the foam comes and goes, it's worth checking with your doctor, especially if it's accompanied by other symptoms like swelling in your hands or feet, edema, or unexplained fatigue. Catching this sign early could help you prevent further kidney damage. So the next time you notice foamy urine, don't ignore it. Take it seriously, and consider consulting with a healthcare provider to rule out any underlying issues. Sign 4, nocturia. Why are you peeing so much at night? Waking up once during the night to use the bathroom is pretty common, especially if you've had a lot to drink before bed. But what if you're waking up 2, 3, or even 4 times every night? That's more than just an inconvenience, it's a potential warning sign from your kidneys. Nocturia, or frequent nighttime urination, can be a subtle but critical indicator that your kidneys are struggling. It's easy to brush this off as a sign of aging or drinking too much water in the evening, but when it happens consistently, there's often a deeper issue at play. Normally, your kidneys slow down urine production at night, allowing you to sleep through the night without interruption. They do this by conserving water and concentrating your urine. However, when your kidneys are damaged, they lose this ability to regulate effectively. Instead of slowing down, they keep producing excess urine, forcing you out of bed and into the bathroom multiple times a night. This constant disruption in your sleep isn't just annoying, it can also affect your overall quality of life, leaving you exhausted and less productive during the day. What's even more concerning is that nocturia isn't just related to kidney issues, it's also closely associated with other serious health problems like diabetes and heart failure. Research shows that people with chronic kidney disease are more likely to experience nocturia, and it's often one of the earliest signs that something is wrong. One study found that up to 80% of people with CKD report nocturia as a symptom. So, if you're frequently waking up to pee and it's affecting your sleep, don't just chalk it up to getting older. This could be your body's way of warning you that your kidneys are struggling to keep up with their usual functions. If you're dealing with nocturia regularly, it's time to talk to a doctor. They'll likely want to run tests to check your kidney function, as well as look for other potential causes like bladder issues or diabetes. Early diagnosis can make a big difference in managing kidney disease and slowing its progression. Remember, frequent nighttime urination might seem like a minor inconvenience, but it could be the first sign of a much bigger problem. Sign 3, blood in urine, hematuria, that's not normal. Let's be honest, seeing blood in your urine can be terrifying. Whether it's bright red or a faint pink tint, it's never a good sign. But here's the thing, while it might be alarming, it's also an incredibly important symptom that you cannot afford to ignore. Blood in the urine, also known as hematuria, is one of the clearest signs that something is wrong with your kidneys or urinary system. Your kidneys are supposed to filter out waste and excess fluids from your blood while keeping the blood cells where they belong, inside your body. If blood is leaking into your urine, it means there's damage somewhere along the way, and it could be a sign of something serious. Now, there are two types of hematuria: gross hematuria, which is visible to the naked eye, and microscopic hematuria, which can only be detected through a lab test. Whether you can see it or not, both types are concerning and should be evaluated by a healthcare professional immediately. The causes of blood in the urine can vary. It might be due to a urinary tract infection, UTI, kidney stones, or even more serious conditions like bladder cancer or kidney disease. The key takeaway here is that blood in the urine is never normal, and waiting to see if it just goes away on its own is not an option. I recently came across a story about someone who ignored this very symptom, thinking it wasn't a big deal. They figured it was just a one-off incident, but by the time they went to the doctor, their kidney function had already declined dramatically. Unfortunately, the damage was irreversible, and they were left dealing with the long-term consequences of untreated kidney disease. Don't let that happen to you. If you see blood in your urine, even if it's just once, take it seriously. It's your body's way of signaling that something is wrong, and early intervention could prevent further damage. In many cases, hematuria is one of the first signs of chronic kidney disease, especially when accompanied by other symptoms like pain during urination, back pain, or swelling in the legs. If you notice any of these signs, it's essential to get checked by a healthcare provider as soon as possible. A simple urine test can detect microscopic blood, and additional tests like a CT scan or cystoscopy may be recommended to find the underlying cause. Hematuria might be frightening, but it's also your opportunity to catch a serious condition early and get the treatment you need. Sign 2, decreased urination. Where did all the pee go? Let me ask you something. Have you noticed a change in how often you're peeing lately? Specifically, are your trips to the bathroom becoming fewer and farther between? If so, this could be a sign that your kidneys aren't producing as much urine as they should, a condition known as oliguria. While decreased urination might not sound as alarming as some of the other symptoms we've discussed, it's still a critical sign that your kidneys are struggling to function properly. Your kidneys are like the body's filtration system. Their job is to filter excess fluids and waste from your bloodstream and turn it into urine. If they're not doing that job efficiently, you'll notice a reduction in the amount of urine you produce. Decreased urination can be caused by various factors, including blockages in the urinary tract, dehydration, or more advanced stages of kidney disease. In some cases, people may also notice that when they do urinate, the output is smaller than usual, or it feels like they still need to go even after just using the bathroom. It's easy to dismiss a reduction in urination as a minor inconvenience, but the truth is, this is your body's way of signaling that something is off. When your kidneys start to fail, they become less effective at filtering waste and fluids, which can lead to a dangerous buildup of toxins in your body. This can cause a host of other symptoms, including swelling in your legs and feet, high blood pressure, and fatigue. If left untreated, decreased urination can progress into more severe kidney issues, potentially leading to kidney failure. One thing to keep in mind is that dehydration can sometimes cause decreased urination, but if you're drinking plenty of fluids and still noticing a decrease, that's a red flag. Your doctor can perform tests to measure your eGFR, estimated glomerular filtration rate, which gives a clear indication of how well your kidneys are working. If your eGFR is low, it means your kidneys are struggling to filter waste, and you'll need to take steps to address the problem. So, if you're not peeing as much as you used to, don't just chalk it up to aging or lifestyle changes. This could be an early sign of kidney disease, and catching it early is key to preventing further damage. Sign 1: Flank pain, when your side starts screaming. This last symptom is one that's nearly impossible to ignore: flank pain. If you've ever experienced a sharp, persistent ache in your side, particularly in the lower back area, it might be time to pay attention to your kidneys. Flank pain can be associated with several kidney-related conditions, and it's often one of the most noticeable signs that something is wrong. Whether the pain comes on suddenly or builds up gradually, it's not something to brush off. Imagine your kidneys as two tiny fists, clenched tightly because they're overworked, blocked, or infected. That's what flank pain feels like. It can range from a dull, constant ache to a sharp, stabbing pain that makes it difficult to move. Flank pain is commonly associated with kidney infections, kidney stones, or more serious conditions like polycystic kidney disease. In some cases, the pain may radiate to the front of your abdomen or down into your groin area, making it even more uncomfortable. One of the key differences between flank pain and regular back pain is that flank pain tends to be deeper and more intense. It often comes with other symptoms like nausea, fever, or changes in your urine, such as blood or an unusual odor. If you've been feeling this type of pain for more than a few days and it's not going away, don't wait until it becomes unbearable. You need to get it checked out as soon as possible. In some cases, flank pain can be a sign of a kidney infection, which requires immediate medical attention. Left untreated, a kidney infection can lead to sepsis, a life-threatening condition. On the other hand, if the pain is caused by kidney stones, your doctor will likely recommend imaging tests to determine the size and location of the stones and the best course of treatment. Regardless of the cause, flank pain is your body's way of telling you that something is wrong with your kidneys, and ignoring it could lead to more severe health issues down the line. What to do if you notice these symptoms? Don't panic, but don't ignore it either. So, what should you do if you're sitting there thinking, wait a minute, I've had one or more of these symptoms? First of all, don't panic, but don't ignore them either. There are steps you can take right now to protect your kidneys and stop the damage from getting worse. Early detection is crucial when it comes to kidney disease, and the sooner you take action, the better your chances of managing the condition and preventing further complications. If you have risk factors like high blood pressure, diabetes, or a family history of kidney disease, you're already at a higher risk of developing kidney issues. But even if you don't have these risk factors, catching these early warning signs can make all the difference. It's essential to take any of these symptoms seriously and consult a healthcare provider as soon as possible. They can run the necessary tests to determine the health of your kidneys and recommend the appropriate treatment options. Tests to get checked. Blood test. Ask your doctor for a simple blood test to check your serum creatinine levels. This will help measure how well your kidneys are filtering waste from your blood, known as your eGFR, estimated glomerular filtration rate. A low eGFR indicates that your kidneys aren't functioning as well as they should be. This quick and painless test can give you a clear picture of how your kidneys are performing and help identify potential issues early on. A single blood test could save you from years of complications if kidney disease is caught early enough. Urine test. Next, you'll want to get a urine test to check for protein or blood. Even if you're not seeing blood or foam, a urine test can detect early signs of kidney damage, such as an elevated albumin to creatinine ratio, ACR. This ratio measures the amount of albumin, a type of protein, in your urine, and high levels can be a warning sign of kidney disease. These tests are fast, painless, and could be the key to protecting your kidneys before the damage becomes irreversible. Treatment options. Yes, there's hope. If you're diagnosed with kidney disease, take a deep breath. This isn't the end of the road. There are plenty of treatment options available, and you still have control over how the disease progresses. With the right combination of medication, lifestyle changes, and medical intervention, many people with chronic kidney disease can manage their condition and continue to live full, healthy lives. Medication. There are medications available that can help control the underlying risk factors of kidney disease, such as high blood pressure, diabetes, and cholesterol. These are key to stopping further damage to your kidneys. Keeping your blood pressure, blood sugar, and cholesterol levels under control will protect your kidneys and reduce the strain on them. Your doctor will work with you to find the right medications and dosages based on your individual health needs. Lifestyle changes. Sometimes, small lifestyle changes can make a big difference in managing kidney disease. A plant-based diet rich in fruits, vegetables, and whole grains has been shown to benefit kidney health. Regular exercise, maintaining a healthy weight, and quitting smoking are also crucial steps to take. These changes may seem simple, but they can have a profound effect on slowing the progression of kidney disease and improving your overall health. Renal replacement therapy, dialysis or kidney transplant. In more advanced cases of kidney disease, dialysis or a kidney transplant may become necessary. Dialysis helps your body remove waste and extra fluid when your kidneys can no longer do the job. A kidney transplant can provide a long-term solution for those with end-stage kidney disease. The good news is that many people live full, active lives after starting dialysis or receiving a kidney transplant. The key is catching the disease early, so you have the best possible treatment options available. Financial burden and prevention. Why you can't afford to ignore this. Let's be real for a moment, treating kidney disease is expensive. Dialysis, transplants, medications, it all adds up. In the US, the average cost of dialysis can range between $72,000 and $90,000 per year, and that doesn't include the cost of medications, doctor visits, and potential surgeries. The financial burden of kidney disease can be overwhelming, which is why prevention is always the best strategy. By catching the disease early, you can avoid costly treatments and protect your financial well-being as well as your health. Regular screenings, simple lifestyle adjustments, and paying attention to those early warning signs can save you from the physical and financial burden of advanced kidney disease down the line. Prevention is the best cure, and investing in your health now will pay off in the long run. Conclusion. Before we wrap up, let's quickly recap the 5 early signs of kidney disease. Foamy urine. Frequent nighttime urination, nocturia. Blood in urine. Decreased urination. Flank pain. If any of these symptoms sound familiar, don't wait. Early detection is key to keeping your kidneys healthy and avoiding serious complications down the line. The sooner you act, the better your chances of preventing further damage. Call to action. If you found this video helpful, don't forget to like, subscribe, and share it with anyone you know who could benefit from this information. Remember, by sharing this video, you could literally help someone save their life. And don't forget to check out our next video, where we'll dive into the top 5 fruits that can help cleanse and protect your kidneys. You won't want to miss it.